Hi there, and welcome to our presentation on No Alcohol. No Alcohol is an interactive web application in support of Canada's guidance on alcohol and health. And for this presentation, we'll be walking you through the design and development process of building the web app. We'll give an overview of the site and its contents, focusing on a demonstration of the risks and benefits calculator. And lastly, we'll share some of our preliminary data about site traffic and campaign reach since the site's launch on January 2nd of 2025. My name is Andrea Cowan. I'm a project coordinator for CSIR, which is the Canadian Institute of Substance Use Research. I'm joined today by my colleague Priya Johal, our research associate, and we've been working on this project under the direction of our principal investigator, Dr. Tim Namey. Go ahead, Priya.
So, in January of 2023, the Canadian Centre on Substance Use and Addiction released Canada's guidance on alcohol and health. And this provided an update to the previous 2011 low-risk drinking guidelines. Now, instead of providing a threshold under which men and women should consume alcohol per week, this guidance presented a continuum of risk associated with weekly alcohol consumption, spanning from no risk to increasingly high risk. As part of this guidance, when it talks about risk, it's primarily referring to health risks, such as the risk presented in this table for diseases and different conditions. Now, for the average person, this type of information doesn't personally resonate with them as an individual since it's based on population level data and the average risks for an average person. In addition to that, the guidance doesn't necessarily provide information beyond health and the impacts of that alcohol use on other aspects of life. So, in order to help engage Canadians with the information in the guidance, our team had the idea of creating noalcohol.ca, a bilingual web application that provides a personalized alcohol risks and benefits calculator where people can enter in information about themselves, how much they drink, and see the health impacts, costs, and calories from their alcohol consumption, as well as the benefits and savings if they were to reduce their drinking. We also have other information on the site in addition to this personalized calculator. So these are the different stages that we went through to create noalcohol.ca. Just to touch a little bit about on our engagement component, prior to starting this project, we conducted a Canada-wide survey as well as put together a Canada-wide advisory group. And both of these parties acted as a way for us to get more information about what it is that Canadians would want to see in a site like this, as well as help us define the content, design, and other aspects of the site in terms of knowledge gaps and areas that we can better inform Canadians about alcohol and health. Now, to give you a bit of a demo of the site, you're welcome to scan this QR code and follow along on your phone. So when you navigate to our site, this is our landing page. We immediately want to draw people to use our calculator, but we also want to put information on the guidance, the key messages associated with the guidance right up front and center. But when you click on the Calculate Now button or navigate to the calculator, here users can enter in information about themselves and based on how much they currently drink, as well as what could happen if they reduce their drinking. This reduced drinking is an optional amount just because we want to focus on informing people about alcohol as opposed to being prescriptive that they should reduce drinking. We also give people the option to navigate between health costs and calories, so they're not obligated to see any one piece of information. So if you click on health, some of the outputs include showing your risk of dying early from alcohol, how many minutes you lose per drink that you consume, as well as your health risks expressed in terms of the equivalent number of cigarettes. And we also have this table that shows your relative risks, so your risks for cancer, cardiovascular disease, and injuries compared to a non-drinker. We also provide information at the lowered consumption level if someone entered in that information, as well as really highlighting the benefits of drinking less. So that difference between the 10 and the 5 and what these reduced risks look like, as well as the gains in terms of minutes of life. We also wanted to situate folks based on their current drinking in terms of where they fall in that guidance continuum of risk. Quickly going to the costs, we also wanted to show folks kind of how much alcohol might be costing them per month, per year, and over their lifetime, as well as the savings if they were to reduce drinking. And folks have the option to enter in their own cost per drink. So if it costs them more, the numbers will update to reflect their own finances. And then for calories, we have similar information, just sort of how many calories per day based on the caloric content in a standard drink of ethanol, as well as a percentage of daily calories and calorie equivalents expressed in terms of different foods, fat, and sugar. And if folks want more information about how we came to calculate some of these results and what these results mean, at the bottom, they're directed to visit our research page, which details a lot of the methods and math behind these numbers, which were developed by the epidemiologists who worked on Canada's guidance on alcohol and health and all of the modeling behind that. And in addition to our calculator, we encourage you guys to explore other aspects of our site, like our general information about alcohol, as well as resources in our knowledge quiz.
Great, thanks, Priya. So just moving into some of our promotion materials since site launch. Since we are doing a national campaign, we went for a fully digital ad campaign across multiple platforms. We identified some target audiences. So we've just finished our general population launch this week, actually. And now we're moving into some more targeted demographics next, running up until September of 2025. And then we also did some media and partner outreach, including preparing a news release around our campaign launch. To see the materials themselves, we'll kind of scroll through what some of our campaign assets look like here. We worked with a Canadian company called Be the Change, really wanting to lean into that idea of a consumer's right to know, using really bright, vibrant imagery, and hoping to kind of leverage people's curiosity when it came to the campaign itself. In terms of our media reach, we've had quite a few media mentions, especially right at the start. The timing was great with the US Surgeon General announcement around alcohol warning labels or cancer labels on alcohol. So lots of buzz around no alcohol itself. And that's been reflected certainly in some of our other metrics. Looking at Meta, which is Facebook and Instagram, about 4.3 million impressions, really high click-through rate. We're really proud to see that we've got 704% higher than industry standard for all of our Meta ads in terms of clicks. Bell Media Analytics, also a fairly wide reach, a little less on the click-through rate, and then some examples of how those ads are being displayed on Bell Media. And lastly, our web analytics. So being able to see that we have about 320,000 total page views with about 115,000 unique users. Most of those users, as you can see, are also viewing the calculator, which is kind of the feature of the site. And the site also has a little feedback form that scrolls around the bottom, and we've had about 513 survey submissions, which has been really useful feedback for us as well. And then just in terms of user analytics, we were really happy to see it's a pretty even spread between males and females visiting the site, as well as a fairly even age spread in terms of demographics. Just in terms of next steps, we're kind of optimizing the site based on user feedback, wanting to build out some of the sections, including the resource sections, using all of those analytics to inform an evaluation for our site and its launch, and then going towards papers to help inform kind of future knowledge mobilization around Canada's guidance. And that concludes our presentation. So thank you for joining us. The QR code there is, again, for you to check out the site. And then that's our contact at the bottom, noalcohol@uvic.ca. Please feel free to reach out, questions, comments, thoughts, or feedback. Thanks so much.